joined by Dr. Hanisyam. So thanks so much for joining us, Doctor.
You're welcome. Thank you for having me.
Okay, so I'll jump into the questions and we can go from there. So, first question is, how do you see the role of cultural or community-specific health beliefs in Ireland influencing patient care? What strategies do you use to bridge any gaps between these beliefs and evidence-based medicine?
Yeah, good question actually. But in Ireland, I don't see many cultural belief, but what I can remember is only one that most of the Irish they like to drink 7-Up. Everything 7-Up.
Yes.
Fever 7-Up, vomiting 7-Up, diarrhea 7-Up. And even a few days ago I saw one baby. He was given a 7-Up because the baby had diarrhea. So which is not good then. So they think that 7-Up can maybe reduce the fever or replace all the electrolytes. Yeah, they replace all the water electrolytes in the body. So this I think is not good because the 7-Up doesn't only have a lot of sugars. It's carbonated, it's acidic. So I think usually what I do, I will educate the parent, educate the patients, saying that the 7-Up is not the proper treatment for those problems. So the most important thing is the water, and the other one will be electrolytes. For example, you can take diarolytes, but the most important thing is actually water, not 7-Up.
And I remember when I was a kid, it was flat 7-Up. So what they would do is they would boil the 7-Up in a pan to remove the bubbles from it, and then they were thinking,
Everything here is 7-Up.
it's so bad when I look back at it, compared to I suppose people just didn't know, but I mean, there's a lot of people out there who would still probably believe that like 7-Up or flat 7-Up is a medicine essentially.
Yeah,
okay. Very interesting. All right. What's an under-discussed health issue in Ireland? What do you believe deserves more attention, and how could addressing it improve the overall well-being of the population?
Yeah, good question actually. But here I can see, but still is improving. Mental health actually, yeah. Compared to where I come from, mental health is not something we discuss or we treat more. But here in Ireland, it's something that is improving. A lot of people discuss about it. Yeah, especially mental health among adults and among young kids actually.
Okay.
So this is something that we have to take attention to.
Yeah. Okay, very good. If you could redesign one aspect of how patients interact with the healthcare system in Ireland, whether it's access to care, communication, or follow-up care, what would you change and why?
So, good questions. I usually two things I can think of now, which is number one, the accessible to see the consultant actually. Very limited to. It's very difficult to see a consultant. It's not because of that. At the moment, I got problem with the. A lot of, for example, surgery being done. There's a lot of complications. Sure, the surgeons want to see the complication they have done, for example bleeding, infection. So and then they will give all those patients to the GPs to handle it, which is I think is not right. I think the doctors, the surgeons have to see a week or two after the operation to see the patient to access for all these complications. That's the thing that I think I think need to be changed, because they send everything to the GPs, which is I think is not right, because the GPs not do all these surgeries. Then if they know that there's a complication, then they have to do something about it. Maybe increase the skills, maybe change the operation. Is it because infection caused by the operation theater, maybe a devices, so they have to see the patients. That's number two. Number one would be accessible to see the consultant. Very difficult to see a consultant. I hope that the HSE can hire more or produce more more consultants, and also have a lot of training posts to the doctors who are willing to do the training.
Okay, interesting. Okay, thanks so much. That's all the questions. I'll take the 7-Up out of the medicine cabinet and we'll go from there. All right, thanks so much for joining us today, Doctor, and very good answers. We'll leave it